Good morning, Whitaker Lane Medical Centre.
The 8 o'clock phone call to the GP. These patients got through, but we know it isn't like that in other surgeries.
You've got more chance of winning the lottery than you have of getting through to my GP.
So you have to start ringing about 5 to 8 and then you might get through it 8 minutes past. And if you're later than that, the appointments have gone.
You wouldn't be able to get an appointment for weeks on end. You'd ring up every day, and even if you went in, they said you had to ring a phone line, and then there's people sat behind the desk with the phones ringing, not answering. So it's quite frustrating. But the one we're at now is really good.
By 9:30 at the Whitaker Lane Medical Centre in Prestwich, they've started coming through the door. This one for a vaccination, a campaign for MMR boosters clearly working in this case.
So some people have described this to me as a paradox, others have said it is quite simply bizarre, but here is the problem. Patients complain that they can't get through to their GPs on the phone, they can't get appointments, they can't get seen for 2 weeks, 3 weeks, even 4 weeks. And yet at the same time, we are now hearing about doctors who can't get jobs in family practices and locums who are out of work.
And today the British Medical Association has released some startling figures. A survey of nearly 2,000 locum GPs in England shows that 4 in 5 are struggling to find work, and a third say they are leaving the NHS.
We've known this has been a problem for roughly 10 months. We have told ministers, we've told NHS England, we've told the Department of Health, and it's got worse and worse over the months since then.
Why has it got so much worse?
We know that the income going to practice is dropping and dropping and dropping. They are cut to the bone. They have no resources around to be able to cover their shifts if they're going on annual leave or sickness leave with locums.
As well as funding falling, there's also £1.4 billion ring-fenced for physios, paramedics or physician associates under the Additional Roles Reimbursement Scheme. So some practices have no choice but to employ them and not doctors or nurses. An NHS spokesperson said while highly trained staff such as pharmacists and physician associates play an important role, the NHS is committed to recruiting more GPs, which is why our long-term workforce plan sets out how we will train an additional 2,000 family doctors. Dr. Suzanne Gaskell is a locum but is also chair of a GP forum in Lancashire and South Cumbria.
I'm hearing now from multiple people the same thing, that they're facing increasing levels of unemployment. Locums who have never struggled finding shifts years gone by are now struggling to find anything at all, and it's putting them in great stress, financial difficulties. I'm hearing of locums who are considering leaving the UK. Lots have already gone overseas to places like Canada, Australia. I'm hearing from GP trainees who are nearing the end of their training with no jobs to go to. And yet there's talk of training up more GPs, but where are they going to go?
This is, in the starkest terms, the reality of general practice in England. The overall number of full-time qualified GPs in England has fallen by 6% since 2015, yet the average number of patients for a GP is now nearly 2,300, an 18% increase since 2015. A few years ago, Dr. Steve Taylor's practice advertised for a new partner. They had 1 application. Recently, they advertised again, and they had 15.
That's a massive difference, and I suspect that's just 4 years. So I think there was a genuine shortage of GPs 4 years ago, but now there's a real opportunity for doctors to get jobs, but actually it's increasingly hard for them to get jobs.
Dr. Taylor has also been working with the Doctors Association UK, a campaigning and lobbying group. His interest sparked by the data.
The only more productive area since the pandemic has been general practice, doing 20% more work. We've seen reports saying hospitals are less productive than they were in 2019. There are reasons for that. It's complex, but general practice is doing more. And it's probably why they're not investing, because they think, well, that's not the problem. But actually, if you ask the patients, it is the problem. The patients all the time are saying, I can't get access to my GP.
And just one more difficult statistic. GPs are paid £165 per patient per year, no matter how many times they come through that door. With inflation, That works out at a £35 cut. And yet still, the phones keep ringing.
Well, earlier I spoke to Health Minister Maria Caulfield, and I began by asking her how she could explain the figures in Victoria's report that 4 in 5 locums, qualified GPs, were unable to find work.
Well, traditionally, and it's still the case today, the NHS doesn't directly employ GPs. We've got a model where GP partners and practices apply for a contract to the NHS, and that money is awarded to the GP partnership or PCN in the area that runs those practices, and they decide how many GPs they have, the mix of staff they've had, and we've seen over 27,000 additional healthcare workers working in primary care. That may be nurses, pharmacists, physios, even
but the GPs are the gatekeepers of the system. The GPs are the gatekeepers of the system. They are the front line, the first line of defence, if you like, of the NHS. And you want to shift more care into the community. So the GPs are absolutely crucial to your vision of how public health is handled in this country. So I just wonder, getting back to this question, how is it possible that it's so hard to get through to a GP's office, let alone get an appointment, and yet there are thousands of GPs who can't find work?
So we are seeing more appointments in primary care. We've met our target of 50 million more appointments available. And we're trying to change the model. That doesn't always have to be with a GP. You know, primary care needs to reflect, as it does in hospitals, where you have a multidisciplinary team. And the GP may not always be the best person to see you. You know, the advanced nurse practitioner, if you've got, you know, something you wish to discuss with a nurse, the pharmacist, if there's problems with your medication, if you've got a bad back or knee problems, it may be the physio. And if you're acutely unwell, sometimes the paramedic is the best person. Lots of these professionals can now prescribe medication and have advanced roles. And so, yes, GPs are important, but the additional roles that we've put into primary care are also freeing them up to see the patients that really only they can see.
There just aren't enough GPs for the demand that's out there. And I'm not sure if you have a plan to fix that, frankly.
Well, we do. We've got our long-term workforce plan. We're doubling medical school places. So to get GPs, you have to train more doctors in the first place. And we are seeing more doctors coming through medical school now. They then spend years training as a GP trainee. But as I said, we are seeing more doctors in primary care. We've got over 500 more doctors this year alone.
How is it possible in that situation that 4 out of 5 locums, qualified general practitioners, are unable to find work that is clearly required?
So what we do as a government is we give the GP contract, which has gone up by 259 million this year, to GP practices up and down the country. They then decide who they directly employ. We do not decide on how many GPs are in each practice or in each part of the country. But in negotiations for the forthcoming year, practices will come to us and say we need more money because we've got doctors that you've trained up and we want to employ them, but the contract isn't enough. And that was part of the negotiations we were doing just before the election was called, but we heard that loud and clear for this financial year. That's why we increased the envelope, the whole funding envelope, by £259 million, and we're hoping that that is making a difference in terms of being able to take on those GPs in individual practices across the country.
Just one more on GPs. I mean, and in very basic terms, there are so many people, anecdotally, also in terms of opinion polls, who are deeply frustrated by the service, you know, especially the elderly. They're desperate to see a GP and they can't get an appointment. They can't even speak to them on the phone often. How do you reassure them that that will change should he get re-elected, you know, on the 4th of July?
Well, what we would say, you know, saying to people, what I'm hearing on the doorsteps is initiatives that we've put in place, like Pharmacy First, so that almost every high street, nearly 98% of pharmacists are taking part in this, that being able to go and see a pharmacist for 7 common ailments is making a difference. And we've put in our manifesto to expand that service further, so that, as they do in France, it's your pharmacist that you go to and see first, who can do prescriptions, who can give you advice on things like your blood pressure, manage your medication. And that is working really, really well.
Just one other question, and it's unrelated, but it's important. And this, of course, is the scandal around bets being placed by people close to the Prime Minister on the election date. How angry are you? How angry are you that your job has just become a lot more difficult as a result of what's happened, you know, with these bets around the campaign and Number 10?
Well, I think I would echo what the Prime Minister said in the TV debates last night. You know, it's indefensible if people have been knowing the date of the election. I didn't know the date of the election. It came as a complete surprise to me. And then making money out of it or putting a bet on.
Should they be suspended?
It is indefensible. Well, I think the Prime Minister has been very clear that if anyone has been found to have done that, he does not want them as part of the party. He's saying that as leader of the party, and I fully support his words in that.
But should they be suspended right now?
It's very... Well, I don't know who's involved, and I think that's the Gambling Commission have said that themselves, that they are looking at a number of cases. But if someone has been identified, then the Prime Minister's been very clear that he does not want them to be in the party.
Maria Corfield, thank you very much indeed.
Thank you.
So that's the picture in England's GP surgeries. What about what happens next, the vital planned care that hospitals provide? Well, our fact-check team has been looking at the election's big issues, and the NHS is one that voters say they care about most. Waiting list backlogs have been much debated as the parties row over the state of the NHS around the UK. From Leeds, our data correspondent Kieran Jenkins has this exclusive analysis.
Well, waiting lists have been a big issue in this campaign, and our fact-check team has been looking at the wait for elective care. That's planned treatments for things like hip replacements and cataracts surgery. Just how much have those waiting list backlogs grown since 2013 in England, Wales and Scotland? While this general election will only decide who governs the health service in England, the parties are very much trading blows in this campaign over NHS performance around the country. So what is the real picture then? Well, each nation of Britain sets its own different waiting time targets. So we'll use each of their own targets as our benchmarks. This dotted line is the 2013 level, and anything above this line means the number of cases waiting longer than the target time is bigger, so doing worse than in 2013. Twice as bad, 3 times as bad, and so on. So first, Labour-run Wales has a target to treat 95% of patients within 26 weeks. But the backlog of cases still waiting after that target time is nearly 8 times worse than it was 10 years ago. Under the Conservatives, in England, a different target. The aim is to treat people within 18 weeks, but that list is now 19 times worse than it was in 2013. And in SNP-run Scotland, there are 2 key targets. One is to see outpatients within 12 weeks. That part of the waiting list is now 30 times worse than it was 10 years ago. Secondly, to start inpatient treatment within 12 weeks. That backlog is now 132 times worse than 2013. Now, these planned care waiting lists are only one aspect of performance and are not directly comparable between nations because, of course, they're each working to their own different targets. But as we recently reported, on an important A&E target that is comparable, Scotland actually performs better than England or Wales. So overall, we can't say which nation's NHS is performing best, but we can say that all 3 nations are wrestling with major backlogs in planned elective care. Now, the Welsh Government told us it's invested £170 million to address waits over 2 years, which have continued, it says, to fall. The Scottish Government says it's making progress and investing £30 million in national and local plans to reduce backlogs. In England, the Conservatives said they are sticking with the clear plan to further cut waiting lists, and they say they will take the bold action necessary.
Kieran Jenkins. Well, joining me now is Sarah Willison, a GP and former Conservative MP who split with the party over Brexit and unsuccessfully ran as a Lib Dem candidate in the last election. Since 2021, she was chair of NHS Devon until she stepped down earlier this week over what she described as funding challenges. Sarah Willison, good to have you back on the programme. It's been a while. Tell us the reasons why... Nice to see you too. Tell us the reasons why you abruptly, and quite dramatically, I guess, decided to step down.
Well, I just felt that the elastic was stretched too far on the funding for NHS Devon, and that we were being asked to make additional savings that I felt that we wouldn't be able to achieve without really impinging on patient care. So I wasn't prepared to, as chair, push those changes through, so it was time for me to step down. And I think that's the point here. It is that the elastic all across the NHS is stretched too far. And it's not just about the day-to-day funding, it's about the funding for our infrastructure, which has fallen into terrible disrepair. We've got a backlog of maintenance. This is just the maintenance, not the new building, of nearly £12 billion now. And it's really having an effect right across care, the facilities that people are being treated in, as well as the equipment. So if we look at things like CT scanners and MRI scanners per head of population, that kind of thing, we're well behind European averages. So it's not just the day-to-day spending, it's about the workforce, and it's also about the infrastructure and some of the pressures out in our communities, as well as social care.
So when we look at waiting lists, and we're rather obsessed with waiting lists, that's only one small aspect, or rather, it was a large aspect. This is one aspect of a bigger picture that you say is just crumbling left, right and centre.
Yes, and I think there's so many pressures right across. I mean, you've already highlighted the pressures in primary care, but when people are waiting very long time, say for hip replacements, then there's a greater demand in primary care. They're much more likely to develop complications from medication that they may be taking, for example, for pain, and they'd be more unfit because they're not able to exercise as much by the time they go in for their surgery. So there's a knock-on effect of that across other parts of the NHS as well.
I mean, there's an awful lot of money that needs to be spent, and there's some very big promises made by both the big parties. When you listen to those promises, are you listening to a genuine, sort of authentic solution to the problems? And are there things that they're not telling us that they should be telling us?
I think there are a lot of things that they need to focus more on. For example, on social care, there hasn't been enough focus on that during the election campaign because that's all part of the wider picture. And also what's going to happen about prevention and early intervention, for example, because that's where we're seeing great inequalities in people's healthy life expectancy. So it's not just about the age that people live to, it's the number of years they live in poor health. And the more disadvantaged you are economically, the greater that length of time you spend living in ill health and the number of conditions you're living with. So it's a very complex set of issues that the incoming government will have to grapple with. But they can't just look at one part of it in isolation. They have to look at the big picture about how we prevent fewer people becoming ill in the first place, how we can treat them at an earlier stage before the impact on them, but also the costs to the wider system. There are lots of ways we need to spend our money in different ways, as well as increase the overall share of the cake that we need, because unfortunately overall funding has fallen behind the historic averages, and so we've had this build-up of a sort of decay of the fabric of the NHS, as well as the gap in the overall funding that's needed in comparison to the rise in demand.
But also what you're saying is that we need to look after ourselves a lot better, and so public health, in other words. And this government has been quite reluctant to touch that because they're afraid of being labelled a nanny state. And I don't hear much from the Labour side either, should they get into power, about what their public health, solutions are.
Well, we know there are all sorts of things that will work, that will help to reduce, for example, the levels of obesity, will help to reduce the problems that people can sometimes run into with alcohol, for example. So we need to see action on those early on, because it can take time.
But they're not talking about it on the campaign trail, are they?
No, they're not talking about it as much as they need to. So we need, as I say, real focus on that prevention and treating conditions early. But also we need to focus on, I think, children and young people a lot more. So we've not heard a lot about that during the election campaign, and not heard enough, in my view, about, for example, dentistry, which is a huge issue for people across the country.
Yes, I remember there was a programme called Britain's Worst Teeth, which is extraordinary in itself, the fact that such a programme exists a long time ago. Sarah Willison, thank you very much indeed for coming on the programme.